Local doctors say they may be able to predict who will get arthritis. They're setting their sights on people who suffer knee injuries. Medical reporter Robin DeWin takes us inside the operating room for an up-close look at this breakthrough research.
But that's what the meniscus looks like, this little piece right here.
You're watching surgery of one of the most common orthopedic injuries. The patient has a torn meniscus. That's the C-shaped cushion on both sides of your knee. You can call them our shock absorbers. They can be torn easily by athletes like Karen Jones.
While I was running in the early summer, I just tripped over a small crack in the sidewalk and twisted it.
Karen will have to undergo surgery to repair her knee. As part of her procedure, she has agreed to be part of a unique study at the U of R Medical Center that's looking to see if cartilage samples removed during this surgery can give doctors clues as to whether Karen would be at risk for osteoarthritis later in life.
Those tissue samples we are using to analyze and study expression of certain genes or markers that we think might have some predictive value.
Dr. Randy Rosier is a professor of orthopedics. He says more than half of all people with knee injuries go on to have osteoarthritis. He says researchers have identified an enzyme that starts the process.
And that's arthritic. When the cartilage gets soft, that's early arthritis.
Over the next 4 years, meniscus tissue from patients like Karen will be looked at for genetic changes.
If you express more of these just because of your genetics, it may make you susceptible to developing arthritis, to an injury where somebody that doesn't express these markers or genes wouldn't.
A baseline MRI will measure the cartilage at the point of injury and then again 3 years later. The information could ultimately help patients at risk by delaying osteoarthritis with supplements or lower impact exercise.
I think it's important for people to be involved in clinical trials. You have to have the surgery and then to be able to help out people in the future.
The ultimate goal of the research down the road would be to give someone an injection that could stop the arthritis process altogether after their injury.
Now, Karen looks kind of young. What's the age range for the research that they're looking at?
She is young. They're looking for people under age 50 who are not arthritic but have suffered a knee injury. About 40 people will be needed for this study. This is a local study, but the money was given by the National Institutes of Health. Very interesting, though, to think that they could maybe stave off arthritis in these people at risk.
Sure is. Robin, thanks very much. Other medical